Hello, everybody. I'm Alex Pasho from Crystal Touch Bell's Palsy Clinic in Rotterdam, the Netherlands. Today, we'll talk about the very important topic and a question that we quite often receive from our patients and from also our visitors on Instagram, YouTube, and also online on our website. And that is the question, is Bell's palsy permanent? Many sources would say that if within 1 year the facial paralysis has not recovered, then it is permanent. It will remain with you forever. In our opinion, it is not entirely correct. And in this video, I will explain why. We will be talking about peripheral facial paralysis, such as Bell's palsy and Ramsay Hunt. Recoveries after traumas and congenital facial palsies. It's a different story, different topic, and we'll probably talk about it a bit later. Before I begin our explanations, let's take a look at the case of one of our patients. Her name is Atlanta. She was affected by the facial paralysis when she was 2.5 years old. When she came to us, she was 65. So we can conclude that her facial paralysis, or at least its consequences and complications, were with her for 62 years. Surgery that was suggested to her before was not an option, and other therapies, electrical shocks and acupuncture, did not bring a lot of improvements. So when she came to us, of course, she was hopeful after all those years, but of course, it was a big challenge for her and also for us because of such a long time that has passed since her facial paralysis. We, together with her, we worked on her rehabilitation program, and I can say that even after the very first working session, she could see first signs of improvements. It doesn't happen every time with everyone that after the very first session you can see immediately the improvements, but it was the case with Atlanta. And by the time when we completed her rehabilitation program, she was much more confident. She was very happy with her achieved results. And of course, she would again enjoy her improved smile. In this respect, one may ask a question: how it was possible that the Atlanta achieved her improvements after 62 years if Bell's palsy were a permanent condition? The answer to this question is rather simple. After 1 year, and in most cases after several months, you don't have Bell's palsy anymore. What I mean by that? Bell's palsy is another name for facial paralysis. And paralysis is the condition when your facial muscles are paralyzed due to the injury to the facial nerve. In the acute phase, in the acute stage of facial paralysis, of which Bell's palsy is one of, your facial nerve does not work. It is damaged, it's compromised, it cannot conduct signals between the brain and the facial muscles. As long as the facial nerve keeps recovering, regrowing, and reconnecting to your facial muscles, when it at least starts to happen, then the facial paralysis is not there anymore because we observe the return of facial movements. It may be slow return, but the facial muscles begin to function. And as soon as muscles start showing some signs of life, the facial paralysis is over. In this respect, some of you may be thinking, well, Dr. Alex, you are wrong. It's already 5 or 10 or 15 years since my Bell's palsy, and I still cannot move my face. Well, it is not entirely correct. You may be having difficulties in facial movements, but in any case, your muscles on the affected sides, they do contract, which means that there is a connection between your brain and the facial muscles. So your facial nerve is functioning, but your muscles are standing each other in a way to the proper facial movements, and that's why your facial expressions are asymmetrical due to lack of coordination in the movements of the muscles on your affected side. All right, let's take a look at one example. Just to let you know that for every patient who comes to the clinic, on the very first working session, we do nerve conduction study and synckinetic correlation test. Nerve conduction study is meant to establish which is the extent of recovery of the facial nerve on the affected side compared to the healthy side. Synckinetic correlation test is meant to measure and to visualize the difference in the electrical activity of muscles on the affected side compared to the healthy side. This is our patient from Brazil. She came to us after several years since the onset of her facial palsy. And as you can see on this diagram and this picture, you can see the two halves of your face during one facial expression, broad smile. As you can see, there's a striking difference between her healthy side and affected side. Also on the picture and on the graphs, which I will explain. We asked this patient to make a light smile, rhythmical, and broad smile, rhythmical, afterward. And we measured her healthy and affected side muscles as far as their electrical activity is concerned. As you can see, the muscles around the eye, the blue graph, and muscles around the mouth, the green graph, on the healthy side, have lower intensity than the same muscles on the affected side, which means that the nerve on the affected side is perfectly capable of conducting the signals that are coming from the brain in the direction of the facial muscles. And you can even see that the intensity of those signals are noticeably higher on the affected side compared to the healthy side for the same sort of facial expressions. Why? From our point of view, the answer is because the brain needs to increase the intensity of contraction signals due to involuntary resistance from the antagonistic muscles. In this case, the muscles that are providing the smile are being antagonized by the muscles that want to pull down the mouth corner. And due to this resistance, the brain is trying to try harder, to pull harder in order to produce the smile. And at the same time, the muscles that oppose the smile are trying to pull down the mouth corner. And that is why on the right picture, you can see that that very characteristic dimple here in the chin and the big, very deep nasolabial fold. And despite all the efforts which are visible here, very noticeable, the mouth corner remains stationary compared to the healthy side, where the zygomatic major muscle, the muscle for the smile, do not suffer any resistance from the muscle that pulls down the mouth corner, the depressor anguli oris, and that's why the eye on the healthy side is unaffected, and on the affected side, it is affected because of the very high level of efforts that the brain is trying to exert in its attempt to produce the smile. So, as you can understand by now, your lack of movements on the affected side is not due to paralysis. Paralysis is over. What you now have is the reduction or change in the mimetic patterns, due to which your muscles, which are trying to produce facial expression, are antagonized by the other muscles on the affected side. And that is why a lot of time your face remains without much movements, despite all the efforts. So paralysis is over, its residual complications are not. And honestly, these symptoms are not going to go away by themselves if you don't do anything. They can remain for, like in case of Atlanta, for a very long time without any noticeable changes if you don't do anything about that. Why it is so? The mechanisms of those complications and residuals, mostly complications, I would call them, are rather complex. And it is not a simple job to get rid of them. That is why working with patients who are coming to us for their rehabilitation programs takes time and takes efforts. We don't do miracles. We don't promise quick fixes or overnight results. No, it involves serious efforts. It involves consistency. It involves perseverance. It involves big, high levels of motivation. It is possible. And if you want to make a next step in your efforts towards the recovery, please do not hesitate to contact us via the website and register for the online consultation. I will be happy to meet you online in person, analyze your face, give my recommendations, give my view on your prospects for recovery, and if we come to a solution or to conclusion, we can make the next step in the direction of your rehabilitation program. Thank you.